Today, we will explore the fascinating anatomical and medical secrets behind the most common types of human headaches. Headaches are a universal human experience, but from a medical perspective, they are divided into two distinct categories you should clearly understand. The first category is primary headaches, where the headache itself is the primary medical problem, not caused by another underlying health condition. In contrast, secondary headaches are symptoms triggered by an external issue, such as severe sinus infections, traumatic head injuries, or serious illnesses. When diagnosing your pain, doctors must carefully rule out secondary causes before focusing entirely on treating the specific type of primary headache. Today, we will specifically analyze the three most prevalent primary headaches: tension type, migraine, and the incredibly painful cluster headache syndrome. Let us dive deep into the human skull to examine the intricate network of nerves and blood vessels responsible for this pain. Your brain tissue actually lacks pain receptors completely, meaning the brain itself cannot feel any physical pain during a severe headache episode. Instead, the agonizing sensation originates from the surrounding structures, including the sensitive meninges, blood vessels, and specialized muscles wrapping around your skull. Understanding this complex anatomical layout helps medical professionals determine exactly why different headaches require completely different approaches for effective and lasting relief. We begin with the tension type headache, which remains the single most common variety experienced by millions of people across the globe. But patients frequently describe this highly uncomfortable condition as feeling like a tight, heavy rubber band is constantly squeezing around their entire head. Anatomically, scientists believe this painful phenomenon is closely linked to the prolonged and abnormal contraction of muscles located in your neck area. These sustained muscle contractions can easily extend upward, heavily affecting the delicate facial muscles and the thin muscular layer covering your scalp. As these specific muscles remain tense for extended periods, they begin to restrict localized blood flow, causing microscopic levels of tissue irritation. This localized irritation directly activates specialized pain sensors known as nociceptors, which are abundantly distributed throughout your delicate skin and muscle tissues. Once these nociceptors are fully triggered, they rapidly transmit rapid electrical warning signals straight through the nervous system directly into the brain. As the brain processes these incoming electrical signals and officially registers them as that familiar, dull, and continuous aching sensation across your forehead. Modern medical researchers also suggest that chronic stress and poor daily posture significantly amplify the overall sensitivity of these delicate pain pathways. Over time, the nervous system might actually become hyperactive, making you feel intense pain even from relatively minor muscle tension or stiffness. Fortunately, tension headaches generally do not cause extreme nausea, vomiting, or severe sensitivity to bright environments, unlike other complex headache types. Simple lifestyle adjustments, relaxing neck massages, and basic over-the-counter medications usually provide highly effective relief for this common daily struggle. However, if the pain persists continuously for multiple days, it is absolutely essential to consult a doctor to avoid further medical complications. Now, let us shift our medical focus to the much more debilitating and neurologically complex condition widely known as the migraine headache. Migraines are notoriously severe, typically presenting as an intense, rhythmic, throbbing pain localized strictly to one specific side of the human head. This debilitating condition is frequently accompanied by extreme nausea, uncontrollable vomiting, and a painful hypersensitivity to normal ambient light and background sound. Medical experts categorize a full migraine episode into 4 distinct anatomical phases, beginning with the subtle warning signs of the prodrome stage. During this initial prodrome phase, patients often experience sudden mood changes, unusual food cravings, or an unexplainable feeling of overwhelming physical fatigue. The second phase is the aura, where about 1/3 of sufferers experience strange visual disturbances like flashing lights or zigzagging lines. These fascinating visual auras are caused by a wave of altered electrical activity slowly spreading across the sensitive cerebral cortex tissue layer. The third phase brings the actual headache attack, heavily involving the crucial trigeminal nerve, the major sensory pathway for your face. When activated, this massive nerve releases specific inflammatory chemicals that aggressively cause surrounding blood vessels in the brain to swell and expand. This sudden vascular expansion stretches the sensitive nerve fibers wrapped around these blood vessels, sending massive pain signals directly to the brainstem. The throbbing sensation precisely matches your heartbeat, as every single pulse pushes more blood through these painfully inflamed and highly sensitive vessels. Finally, the postdrome phase leaves the exhausted patient feeling completely drained, confused, and physically weak for up to an entire day afterward. And treating migraines often requires specific prescription medications designed to carefully constrict these expanded blood vessels and block those destructive inflammatory pain chemicals. The final primary category we must thoroughly examine is the exceptionally rare but incredibly devastating condition universally known as the cluster headache. Cluster headaches are widely considered by medical professionals to be one of the most agonizingly painful physical experiences a human can endure. These severe attacks occur in cyclical patterns, or clusters, striking the patient multiple times a day for several weeks or even months. The unbearable pain is fiercely piercing and strictly concentrated behind or directly around one specific eye, never switching sides during an attack. Anatomically, this intense condition is deeply linked to the sudden hyperactivation of the hypothalamus, the tiny biological clock resting inside your brain. This deep brain activation simultaneously triggers the autonomic nervous system, producing bizarre physical symptoms on the exact same side as the pain. Patients visibly suffer from a drooping eyelid, a continuously watering red eye, and severe nasal congestion localized strictly to the affected side. Because these rapid attacks peak within minutes, standard oral pain medications are completely useless, acting far too slowly to provide any relief. Instead, modern emergency treatments heavily rely on administering pure oxygen therapy through a mask or utilizing extremely fast-acting injectable nerve medications. By deeply understanding these diverse anatomical mechanisms, we can clearly appreciate why a universal cure for all headaches simply does not exist. Your primary tension headache requires gentle muscle relaxation, while a severe migraine demands precise vascular control and targeted biochemical nerve pathway blockage. Meanwhile, an agonizing cluster headache necessitates immediate neurological intervention using high-flow oxygen to rapidly calm down the hyperactive deep brain structures. If you frequently suffer from debilitating head pain, diligently tracking your specific symptoms in a daily journal is a highly beneficial strategy. This detailed personal record tremendously assists your dedicated doctor in accurately diagnosing the exact anatomical root cause of your ongoing neurological distress. Never completely ignore sudden or exceptionally explosive head pain, as it might strongly indicate a dangerous secondary condition requiring immediate emergency care. Thank you for watching today. We hope this deep medical journey helps you understand your complex body much better now.